Crisis intervention and suicide prevention are essential skills for mental health practitioners and caregivers. A mental health crisis refers to an acute situation where an individual's usual coping mechanisms are overwhelmed, resulting in severe emotional distress or behavior that threatens their safety or that of others. Suicide prevention focuses specifically on recognizing and responding to signs that someone may be considering taking their own life. This module provides comprehensive knowledge on how to identify crises, recognize warning signs of suicide, employ effective communication and intervention techniques, and develop safety plans to manage risks. It also highlights the importance of post-crisis follow-up and multidisciplinary teamwork in supporting individuals through recovery. By the end of this module, you will be able to define a mental health crisis and differentiate various types of crises. Identify behavioral, verbal, and situational warning signs of suicide. So, employ active listening and empathetic communication in crisis situations. Apply de-escalation techniques to reduce immediate risks. Collaborate in developing safety plans tailored to individual needs. Understand post-crisis care referrals and legal considerations. Appreciate the role of mental health professionals and crisis teams in managing emergencies. Recognizing suicide warning signs. Warning signs may be subtle or obvious and include expressing feelings of hopelessness or being trapped, talking about wanting to die or kill oneself, withdrawal from friends, family, and activities, increased substance use or risky behavior, sudden mood changes or calmness after a period of depression, giving away possessions or saying goodbye. Risk factors include prior suicide attempts, mental health disorders, depression, bipolar disorder, family history of suicide, substance abuse, chronic illness, trauma, and stressful life events, for example, job loss, relationship breakdown. Crisis intervention techniques. Effective intervention begins with active listening, giving full attention, reflecting feelings, and validating the person's experience without judgment. Communication should be calm, compassionate, and non-threatening. De-escalation techniques help reduce agitation or aggression, such as speaking slowly and clearly, avoiding confrontation or arguing, maintaining a safe physical distance, using grounding techniques to focus on the present moment. Assess immediate safety by asking direct questions about suicidal thoughts, plans, and means. If there is imminent risk, do not leave the person alone and seek emergency help. Safety planning. Safety planning is a collaborative process that empowers the individual to manage suicidal impulses. A safety plan typically includes identifying personal warning signs and triggers, listing internal coping strategies, for example, deep breathing, distraction, recognizing social contacts who can provide support, contact information for professional resources and crisis lines, steps to make the environment safer, removing access to lethal means. Post-crisis support and follow-up. After a crisis, ongoing support is essential to prevent recurrence. This may involve scheduling follow-up appointments, coordinating with mental health professionals for therapy or medication, engaging family or community support networks, monitoring for warning signs of relapse. Effective follow-up reduces hospitalization and improves recovery outcomes. The role of mental health professionals and crisis teams. Mental health crises often require a multidisciplinary approach involving psychiatrists, psychologists, social workers, nurses, and crisis intervention teams. These professionals conduct risk assessments, provide emergency care, and develop treatment plans. Legal and ethical considerations include respecting patient confidentiality, informed consent, and the use of involuntary hospitalization when there is an immediate danger to the individual or others. In summary, crisis intervention and suicide prevention are vital in mitigating the effects of acute mental health emergencies by recognizing warning signs, communicating empathetically, developing safety plans, and ensuring follow-up care. Mental health workers and caregivers can save lives and promote long-term wellness. Collaboration across disciplines and adherence to ethical standards strengthen these efforts. I hope you enjoyed this module and see you in Module 8.